I mentioned before how ballistic movements can be a forced alternative for repeated movement testing and therefore repeated movements as treatment for the presentation of a mechanical joint derangement. In addition to ballistic movements, however, we also have sustained positions. While I don't use ballistic movements very often as a forced alternative, I use sustained positioning a lot. So when we think of repeated movements, we're thinking of doing a set of 5 or 10 or 15 movements. Sustained positioning is repeated in that you're still doing it throughout the day at least 6 times typically. But instead of doing 10 or 15 repetitions, you're going into the position of the joint that we desire and holding it anywhere from a few seconds to a few minutes. It depends on the patient presentation. So instead of repeatedly moving into shoulder extension, you're putting your shoulder into end range extension and you're holding it. Or instead of going into side glide of the lumbar spine against the wall 20 or 30 times, you're pushing the hips or the pelvis to end range into the wall and holding it for 30 seconds or a minute or 2. As I've mentioned before with my orthopedic evaluation, the specific verbal history and taking the orthopedic baselines give me so much information going into part 3, which is testing. And one thing I may be listening for mechanical joint derangements as a diagnosis is whether or not the person seems to have a preference for certain movements or certain positions. For example, if someone has just typical central low back pain, but they can squat or bend over to help with their kids or with cleaning and they have no problem, which is lumbar flexion, but then they sit for an hour and the lumbar pain comes on, that's telling me that possibly this person's low back, if it's a mechanical joint derangement, will not respond to repeated extension, but might respond to sustained extension because the presentation takes a sustained amount of flexion to produce pain. These are just things that are making me think what test would be most effective because my goal is to be efficient. But the cause and effect nature of the repeated movement testing is what's really giving me the answer I need. Say we do repeated extension for that hypothetical patient and things improve. Well, then we might not need to go to sustained. But say we test sustained and it's even better, then I will go with that. I've seen many patients for whom repeated movements in a specific direction yield benefits, but they don't make the patient 100% better. But once we hold that position, again, anywhere from a few seconds to a few minutes, the symptoms and the signs resolve. So sustained is a force alternative, just like ballistic movements. I'm usually thinking about 5 levels of force progression and using the least amount of force to get the results that we want, meaning we want the least amount of risk we have to put through the patient's body to achieve the desired results, meaning getting rid of the signs and getting rid of the symptoms. But for some people, doing it repeatedly is not enough. And so clinicians need to understand that they can apply that same movement, but in a sustained way and test it. And most clinicians or even patients will be pleasantly surprised when they realize that just by holding it for a little bit longer, they get the results that they want.